Hello and welcome back to Compassionate Conversations. My name is Carlos Frick, Communications and Advocacy Manager at NAMI Racine County, and your host today. The first week of October marks Mental Illness Awareness Week. And during this week, NAMI Racine County, along with other organizations, promotes different events to raise awareness on mental health and mental illness. And through education and information, to end the stigma toward mental illness. Today, we're having a conversation with Luann Simpson, a longtime NAMI member, activist, advocate, and now retired NAMI Racine County Program Director. Welcome to Compassionate Conversations, the podcast produced by the National Alliance on Mental Illness, NAMI Racine County, discussing subjects related to mental health and mental illness. Hi, Luann, and welcome to Compassionate Conversations.
Hi, Carlos. Thanks for having me.
Now, Luann, I already said some of the things that you've been doing throughout the years, but I always like to give the opportunity to people to introduce themselves. So tell us a little bit who you are and what you've been doing all these years.
Okay. Well, I'm an individual that lives in recovery with bipolar disorder for many years. Currently have not had any real symptoms, but do a lot of things to keep myself in a healthy state of recovery. I came to NAMI 25 years ago and walked in the door and never walked out.
Well, you try a couple times.
That's right. I've retired 3 times. But I don't know that anybody walks away from NAMI or the work of NAMI because it's about passion and love and work that really needs to be done. And when I was first diagnosed back in 1986, we heard nothing about recovery. We often were not treated well. Sometimes the treatment was worse than the illness. And I made a decision once I moved into a level of recovery that I was going to go to grad school. I had my undergrad, and I was going to go to grad school, become a social worker, and try to be a very different kind of social worker. And never did I imagine where I would end up. We all pretty much want to be therapists when we go into clinical social work, but I did end up at NAMI and stayed out of love, I think, love and passion, and what it allowed me to do. And a true place that really truly does help people.
Well, that what you were mentioning at the beginning, how you were treated.
Yes.
And that how it was, probably worse than the disorder. It's sort of what we want to talk about or all the time, which is looking for a better life for people who live with mental illness and those who are affected, because as we know, it's not just the person living with the mental illness, but also family members, friends, and so on who get affected by it. And that's precisely what we talk about when we talk about ending the stigma, taking out this idea of or negative ideas and connotations toward people who live with mental illness. Now, we do talk a lot about the stigma, but in your experience, what is a stigma?
Well, if you think about in terms of what is stigma, I sometimes struggle because a lot of people, we know that we want to bust the stigma, we know that it has effects, but when we try to actually define what is stigma, we struggle a little bit with that. And so we know what we experience. And I really see stigma as kind of 3 pieces, where, first of all, stigma is attributing, my definition of it is attributing something negative to someone based on something about them. So in this case, it would be the fact that they live with a mental illness. We attribute something to that, be it that people like that are not smart or that they're violent, that sort of thing. They can't work, they're homeless, whatever it is that we attribute to them simply because they have a mental illness. But I think there's 3 components to that, and it's really kind of stereotyping, which is kind of a piece of what I was just talking about, attributing that to someone based on a certain characteristic that they have. But I think there's also a level of prejudice where you have this preconceived opinion about people, not based in any kind of reality or reason. And the next step, I think, is really important, because I think this is what affects us so much, is discrimination. So it's kind of a tier, right? If you can have these negative thoughts about people, but you don't act on them, it probably doesn't have as much of a effect on them. But when we get into discrimination, where people don't get jobs, people aren't treated well in the healthcare system, your neighbor, your neighborhood, whatever discriminates against you in certain ways. You don't get invited to things. So
Right, you get treated as an outsider,
Right.
somebody who doesn't seem to have the same rights and deserve the same attention than other people just because you live with a mental illness, even though you might not be in a crisis and you might be as,
Sure.
as regular person as anybody else. Now, this is actually something that is, I think, is an invisible part for most people when it comes down to stigma, and is, for instance, the lack of job opportunities, the problems or lack of housing, lack of meaningful relationships, because there is an idea that at some point something is going to happen and you're not going to be able to function regularly. I said it in our previous episode that some people believe that people who live with mental illness are somewhat broken, but we are all somewhat broken. It's not the mental illness that breaks you. We all have some mental health concerns that we deal with throughout our life, and it's precisely the stigma against mental illness that makes it so significant toward people who live with a mental illness. Now, in your own experience, because you were diagnosed in the 80s, correct?
Mm-hmm. Yes.
So back in the 80s, how did it treat you, and has it changed from then to now?
The stigma in
stigma,
general.
correct,
I even within your family and friends, somehow they didn't necessarily want to be seen with you or you invite you to things per se. They might be concerned about what other people might think or what you might do or say.
Right.
I mean, we're not always well.
Right.
And part of having a mental illness is sometimes, obviously, they call it behavioral health. Not my favorite term, but it is seen in behavior at times. So, I think the healthcare system sometimes discriminates against people because they have mental health symptoms. I had a degree in psychology. I was working in the healthcare field. There's a lot of discrimination there, which is odd to me.
Right.
But people, and back then, people not believing that people could get better, discouraging you from, going to graduate school or having some kind of other hope or dream, and talking about you need to be more realistic about that. I said you don't take people's dreams away from them. Maybe they need to be altered in some way, but you don't take people's dreams away from them, because that's called hopelessness. Yeah. And we know when hope is gone, that's a true challenge. We lose people to lack of hope.
Oh, that is an important point. We do lose people to lack of hope.
And do you know what NAMI does? Those of us that work at NAMI that do this work, that have been there, we get it. We provide support to people. When people lose their hope, we hold it for them until they get it back.
Oh.
And we help them find it again.
Now that's going to be the phrase of this episode. We hold the hope until
they get it back.
Get it back. Well, now, we would say acceptance of mental health and mental illness is higher now than it used to be. Do you think that stigma is still very prevalent, though, in society?
I do think that stigma is prevalent in the sense that, first of all, you're correct. We hear more about it. More people struggle with it. But while NAMI kind of has a phrase that we don't judge anyone's pain as less than our own, I do think some of the things that we don't necessarily classify as severe or persistent, which is kind of an old term that NAMI used, some of the more illnesses that have some, symptoms that are a little more disturbing to other people, that's the area where we see a little more stigma. It's okay to go get treatment for depression or anxiety, but those are people, that I don't know, I always say just because you have a Xanax in your purse, doesn't necessarily mean you have a mental illness per se. So I think that people that live with things more serious have more serious symptoms, things that look a little scary or disturbing, things like delusions, hallucinations, mania, self-harm, things like that people don't understand that continues to be stigmatized. So I think that's the piece of it that is probably a little more stigmatized and continues, that we really need to to work on.
Right, because maybe we're more accepting of certain illnesses, but
We're more
not
accepting
of all
the
of them.
idea of it. But are we
Oh.
as accepting of the people who are experiencing it in a way that we don't understand or we find disturbing? I mean, I'm talking, a bit about community inclusion.
Right.
I get the sense people that have some of those symptoms that I just mentioned, that we kind of want them to go get better. Go get better, go get treatment. We're open to that, right?
Right.
People should get treatment. There should be more of it.
Yeah.
But do we invite them into the community when their symptoms are not under control? Because some people, they're never going to be totally under control. Doesn't mean they're not in recovery. Doesn't mean they cannot be part of a community.
That is a very good point.
And so a good part of recovery is social inclusion. Not isolating, but also being included in the community. So while it's important to be with the people who get it, to go to support groups, to go to education classes, to come to NAMI or whatever is out there for people that have common experience with mental illness, as important as that is, it is also important that it is not your entire life.
Right.
That you're going to book clubs and church if that works for you, that you're going to restaurants, you're going into these places where everybody else goes, not just the cafe for the people with the mental illness symptoms. So sometimes it's, yes, inclusion, but you get those symptoms under control and then you can come and be with us. I think families sometimes fall into that.
Right, even the close ones to
Yeah.
people who live with mental illness. And where do you think that comes from, the stigma itself? Is it lack of understanding? Is it lack of education? Is it fear?
I think it might be fear of discrimination towards the family themselves or such. I remember, and things have changed a lot from my family too.
Right.
But I remember we had a family photograph, my mom, my dad, my brother, my sister-in-law, and their 2 kids. I wasn't in it. And I remember saying, well, that's when I wasn't in the family.
Okay.
That's when I was
Right.
ill.
Yeah.
And innocently, my mother said to me, they had a retirement party for my dad, and they didn't invite me. And they said, well, we were afraid you would come.
Oh.
So she didn't mean it.
Yeah.
I think she actually, it was out of town, and I actually think she thought that I would feel like I had to go or whatever. But it just, kind of came out a little, like, I think, I have bipolar disorder. If I was experiencing mania, it's hard.
Right.
It's hard for people.
There's something that you just say that it just hit me, because it is like we'll hide you while you are going through your crisis, and we will receive you when you are back to normal.
And when you're all better and you get an award for it,
Right.
we'll be proud of you and put
Yeah.
you out there. And
So that is another way of
but
stigmatization.
for me, that's that change over time.
right.
That's that lack of understanding. As the people around me, my family, my extended family, learned more about it and started seeing me, and I do have extended family that don't live here, most of them, and so they would hear about what I was going through, but when they actually talked to me about it, and that started to bring it down, they'd be like, wow, she really is articulate, or she really knows,
Right.
knows this stuff. And then they started asking for help from me for other situations that they were experiencing with their own immediate families.
So education is
I think
still
education. 2 things
key.
that come out of what I just said, right? That reduce the stigma, and this is research based as well.
Right.
It is people sharing their stories,
Mm-hmm.
and not just famous people, but people from their own communities.
Right.
Sharing their stories in whatever, if it's a formal standing in front of a couple hundred people sharing your story, or if it's
Right.
me sharing my story with you.
Right.
Because suddenly I don't become the mentally ill, I become Luann
Right.
with a life and an experience. And then you get to see beyond that mental illness to who I am, and that reduces the stigma. And then educating people, for instance, those disturbing behaviors that I talked about. If people understood the person who's talking to themselves, that doesn't mean that you can't have a conversation with that person.
Right.
That they're totally capable of that. They might be having an experience of something, maybe hearing voices in their head that they're talking to.
Right.
It does not eliminate their ability to interact in the community or have a conversation with you, and an intelligent conversation.
Right. Right.
But people don't understand that. If they did, if they understood that you can talk to someone with mania, you got to interrupt them,
right.
and you got to say, hey, I'm not following you.
Yeah,
I
yeah,
want
yeah.
to.
Yeah.
Help me understand where you're going with
Right.
this. kind of stay on track. I do think education is key, but I also do think meeting people and seeing beyond, so that you no longer are, you're no longer the mentally ill person.
Right, the experience of the person, that
right.
the person becomes a person and
They
not
become a
just a
person to
person
you.
living with mental illness.
That's part of the problem with the mentally ill. My air quotes that nobody
Yeah.
can see. The homeless is that's a group of faceless people
Right.
who don't have.
If we don't have contact
strengths,
with them,
they
right.
It's just faceless people.
That's a really good point, and I would say, especially for those listening to this, if you're not living with a mental illness, but you have the opportunity to talk to somebody who lives with a mental illness, respectfully ask about their experience and how they feel with regards to you as well, because again, I think that most people or one of the reasons why a stigma exists is because we don't feel how that affects the other. In most cases, we don't feel that that's causing any damage in most cases. But we do know that stigma actually prevents people from seeking services. I think the American Psychiatrists Association says that at least 50% of the people who live with a mental illness do not receive, or they take too long to receive services because they're not seeking or looking for services because they don't want to be treated differently. And I think that when we think of those faceless mentally ill people, we might be talking about our neighbor, our cousin, somebody in our own lives, because if 1 out of 5 live with mental illness, we are probably in contact with somebody, even if we don't know that we are.
Sure. I have a master's degree in social work, which means I have to get continuing education credits to keep my license up. So I will go to these things, and it is beyond me. 1 out of 5 people, right? So there are people in that room, whether they're,
Right.
And a lot of people come to the profession because they've been through an experience, they understand it, they get it, and that they can be good practitioners.
Right.
Doesn't mean you have to have been there and go through it.
Right.
Many people can be empathetic and compassionate without having had the actual experience. But a lot of people are drawn to the profession. So you go to these continuing education things and you sit here and you hear things and you think, they're talking about me. They're talking about me. I've heard things like borderline personality disorder, which is one of the more highly discriminated against illnesses. It is getting better because we now know people can and do get better. They get to a level where they do not meet criteria for that illness.
Right.
So it can be over a 10-year period. But they say things about that, like borderline is what we call people we don't like. And you think, you're talking about me,
Yeah.
So I think that's challenging. I just went to something probably a month ago where they were talking, group of professionals, and the presenter was talking about the use of terms like schizophrenic and things like that. I'm like, I can't believe we're still having this conversation. Aren't people that are going through these programs in school now, isn't it just the way it is? Don't we just talk like that now? But
Right.
no, we continue to have to present that to people.
Yeah, I mean, again, because I guess education is the biggest challenge. Now, I want to turn the conversation a little bit on one type of stigma. That there are three types of stigma, right? So there is the public stigma, there is the personal stigma, and there is the institutional stigma. The personal stigma is one thing that we do not talk about much, because personal stigma is our negative attitudes toward ourselves and shame for living with a mental illness. How do we combat that, and how can we reach out to people who might be experiencing that kind of stigma? I mean, obviously we will have to know that they live with a mental illness, but sometimes the best assurance to anybody is not letting them know that we are, supporting them or ensuring. So what to say? How do we help those people who are living with that kind of...
So compassion is the antidote to shame. Okay? And, we all have shame, and we don't talk about it, right?
Right.
And the less we talk about it, the more we have it. Shaming people is never beneficial. It is never effective. And shame is really when shame is easy to define, really. Shame is, I am something wrong, bad, whatever, where as opposed to guilt is, I've done something wrong. And guilt is totally appropriate at times. So in the sense that compassion is the antidote to shame, then self-compassion can be the antidote to self-stigma. Finding compassion for oneself. And really, one of the ways that you can get to that is the issue of common humanity, which means that we understand that everybody has some kind of experience,
Right.
whether it be mental illness or symptoms of mental illness or something that we feel shameful about. And it's human nature. So there's a common humanity piece. But you can learn skills. I mean, the research, again, pans out. You can learn skills, and they change your brain. Your brain function kind of such that you can become more compassionate towards yourself. When we start to look at how we're judging ourselves and look at about what is that judgment, what need is that meeting for us to judge. Sometimes it's often a need that we're meeting. And just thinking about, you might not even be able to figure out what it is, but just thinking about, there's a need I'm trying to meet in whatever kind of behavior I'm engaging in, and opening yourself up to that in yourself and other people is what brings you down to a level where you're way more open for compassion, either towards yourself or others.
So compassion is the key word.
I think compassion and self-compassion is the antidote to shame.
Well, I'm hoping that the fact that we are in compassionate conversations is something that could help some people who might be living with certain stigma. But also,
I think, Carlos, it's important to recognize that we talk about empathy a lot.
Right.
And empathy, we define as feeling with.
Right.
Compassion is the next level. They are not the same thing. Compassion is wanting to, empathy is kind of feeling with, digging deep, finding something in yourself that connects to what that person is feeling. Yeah. Compassion is wanting to help to relieve that person's suffering.
Oh.
Okay? Taking some kind of action to help relieve that person's suffering. So there is a fine distinction.
An important one, because it makes us get into action. And that's actually my next question to you, because you've been an advocate for many years, and you still are, and you are an activist for mental health and mental illness in different levels, one-on-one, systematic, with legislators and so on. So what would you tell people who might be living with a mental illness, who might have family members, loved ones, people that they know who might live with mental illness, and they want to advocate for them? How do we engage into advocacy for a better and a more compassionate society?
Right. So I think, again, back to knowledge is power. So being knowledgeable, knowing about resources. Sometimes people don't know what they need. Even so finding someone that can help you figure out what you need.
Right.
It's really hard to look up to find where is this when you don't know what it is that you're
looking for.
What you're looking for, right. Per se. So being kind of educated about that. I do think if you kind of do some of your own research, that you can be knowledgeable, and don't let people ignore you. Don't let people shove you down. Be polite. But be educated,
Right.
And think enough of yourself or your family member that you're going to move forward and get what you need. I personally struggle with some chronic pain issues, and I ended up finding a doctor and getting relief. I don't think I'd ever have gotten there because I have a mental health diagnosis, right? That hovers over me. I read a note that a doctor that I saw early on wrote, I have neuropathy in my feet because I have diabetes. Okay, so his note started out with pleasant 62-year-old female with bipolar disorder. What that had to do with my diabetes it didn't say diabetes.
Right.
When diabetes is known to cause the problem with the
Right.
feet. So they start not taking you quite as seriously.
Yeah.
And so you often, maybe your doctor doesn't make a referral. Well, maybe you refer yourself,
Right.
you know, but you don't give up. You think of yourself as important enough. I think that being not being aggressive in your advocacy in such that you become angry or
Right.
mean. You can be. We're all angry about it.
Yeah,
But
yeah,
when you kind of, I used to say to someone that was a strong advocate who really got kind of aggressive about it, I'd say, "Be nice." Be nice. And she said, well, nice doesn't get you anywhere. My experience is nice, respectful, knowledgeable can get you somewhere.
Right.
And reach out and ask, reach out to NAMI. We you know, knowing, like I said, where to go, who to talk
Right.
to, and how to ask for the right things, using the right language. You might need some education around that, some
Yeah.
training. But think you're worth it, think your family's worth it, and don't give up.
That is an important part. Don't give up and get
Lots
educated.
of things have happened due to advocacy.
Right.
Mental health parity we fought for forever, treating people equal.
Right.
Years we were fighting that, we were marching on that. Way back when it was, you did not have to pay for mental health the same way that you had to pay for anything else, if you paid for it at all under insurance policies. We fought that forever. We went to hearings, you know, we met legislators, we got our bullhorns out and marched on the Capitol, and we got that passed. It took a long time, and we got that passed. Now we're continuing to see how that's enforced.
Right.
Because once something's passed, you
have to follow through.
You have to follow through. It has to be funded if there's funding necessary. And so just because you get a bill passed doesn't mean it's a law. And when you get a law passed doesn't mean it's funded. And when it's funded doesn't mean it's being instituted because it's not regulated or checked up on enough. So keeping on top of those things. Build a relationship with your legislators. Go to your legislators when you have issues. Your county supervisor, I mean, that's someone people don't think to go to. Or
Right.
your city alderman.
Right.
You know, go to those people, educate those people, tell them your stories. This is how you get results. Know that we have a protection and advocacy organization in every state. We have Disability Rights Wisconsin.
Right.
There are people that advocate for people with mental health issues. They are folks, and if they can't help us, they can tell us who can.
Where to go?
Where to go? Who can? And then, you know, until you can self-advocate, what I would hope is that people like myself can walk beside you to advocate with you until you can advocate for yourself.
So yeah, that's what organizations like NAMI do. They accompany you throughout your process. Even for some people, because they actually have experienced themselves the stigma and the experience of mental illness. Others because we have witnessed it with our loved ones. But I think that the one important part is that it unites us is the new understanding. And to me, I say this as a self-discovery. To me, is a new understanding on things that now I feel much more educated about mental illness, and I can understand those who I love who live with a mental illness in a way that I could not before I even joined NAMI. And now when I have conversations about this or with people who live with mental illness, my perspective is much more different. And I thought I was being empathetic before, but I feel that now I move on the process of compassion, which is what you say is the next level. It changes you. Even if you're not living yourself with a mental illness, it changes the way you look at it. And I do believe that is the way to end the stigma, to understand the people who live with a mental illness, not thinking that it's a mental illness, but thinking that it's a person.
Right. And like I think a lot about cancer. Breast cancer and the awareness around that. Relay for Life.
Right.
How well that is attended.
Right.
If we could get people to come out for mental illness like that, and I do believe it's partly the stigma.
Right.
That's because we don't want to raise our hands. And
right.
often we think, well, if I go, they're going to think that I have that illness.
Right.
I spent a good part of my career standing up and telling my story, so I've gotten kind of beyond that. But I have my moments where I'm not going to raise my hand either, because I continue to feel that stigma, and it doesn't feel like the right time. I've shared my story publicly with the paper say,
Mm-hmm.
and I'm not sure I was aware of what the World Wide Web meant at the time.
Mm-hmm.
It means everybody can know if
Right.
we all know how to Google, right?
Right.
But I'm at peace with that. I told my story to some student nurses, and I've been doing it for years, and someone asked me, like, why do you do this? I said, because it couldn't have been for nothing. What I went through could not be for nothing. I had to turn it into something good. I've been through the fire, and I've come out the other side. I got to help people to navigate that so it's not as hard as it was when I did it. And hopefully they can navigate it. I sat next to a person who came to our group who has navigated through her recovery much more quickly than I was able to, because she came to NAMI.
And that's the important part. I mean, that for the next generation coming in is going to be somehow easier, hopefully, if we can make the changes that we want to make in society.
It's got to be a better world. It's got to be a better world going forward, and I think those of us who've been through it can contribute to that in enormous ways.
Now, again, thank you for this conversation, because I feel that it lifts the veil on a lot of stuff that we probably do not even think about in with regards to stigma and regards to mental illness. Is there anything else you would like to share with our audience?
Well, I think it's important for people to know, and I'm not sure that everybody does, is that recovery from mental health issues is not only possible, it is probable. And we cannot predict who is going to move to what levels of recovery. We must provide to everyone what they need to get there in order to get them there.
Believing exactly that recovery is possible. It's not only it's not just a possibility. It actually does happen. It's a probability.
But people need to get what they need to get there. And when we see people that are, actually, I see myself as being old, but there are people that are older than me, surprisingly enough, and some people that have been through the system before I have. We kind of look at that and think these folks are beyond, any kind of recovery. And I think part of that is because the healthcare system didn't believe in it, so people didn't get what they need.
Right.
Part of it is because we didn't have what they needed. A lot of research, a lot of new things coming out. That kind of thing. But part of it is you need someone to say, I believe you can recover. Mm-hmm. That is so important. Include people in the community. That's a huge part of it. But having someone say, I believe in you.
Right.
I believe you can move into recovery, and having those role models to see that people do, that they can and do. Not everybody gets the resources are slim. Not everybody has supportive families. Not everybody has insurance. And these days, even if you do have insurance, sometimes getting the services. Not everybody got, what I got.
Right.
And it breaks my heart that they can't get what I got. And I will do everything, probably till my dying day, to try to make that different, to try to make sure that people that live with mental health issues can get what I got to get where I am.
Now, that is a great way to finish our conversation today. Again, I want to rescue what you said before about empathy and compassion, because if there is anything that I think that we should remember from this conversation is moving from the empathy of just trying to connect with somebody to the compassion of what you said before, holding their hope when they lose it until they have it back, and also being the hope that they need in their life, moving toward a more compassionate society. Thank you again, Luann. Thank you for this conversation, and I'm sure we will have other ones some other time. Thank you to our listeners for your support. You can always leave a comment or questions in our episodes. And until our next compassionate conversation. Compassionate Conversations is brought to you in a partnership with United Way of Racine County. Thank you for your support. NAMI Racine County is a local affiliate of the National Alliance on Mental Illness. Our vision is to create a compassionate community where all people affected by mental illness live healthy, fulfilling lives. NAMI Racine County provides advocacy, education, support, and public awareness so that all individuals and families affected by mental illness can build better lives. Visit us at www.namiracinecounty.org for more information on mental health and related activities.